Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Yes, indeed. This is Jerry Hickey, nutritional pharmacist. I'm also the scientific director over here at Invite Health, and I'd like to discuss the effects of Resveratrol, a well-known nutritional supplement, on bone health. Resveratrol has many human clinical trials behind it. Most of the human clinical trials have to do with its vasoactive activities. Vasoactive means it supports good circulation to the legs and the muscles and the heart and your organs and tissues, but also to the brain. And that's one of the reasons why in study after study, resveratrol has positive effects on supporting memory and brain health in aging people. But today we're going to discuss the effects of resveratrol on bone health. Many decades ago, researchers and medical doctors started to recommend weight-bearing exercises to protect bone and to build bone, to rebuild bone like in older women, etc. So weight-bearing exercises work against gravity. So you're putting pressure on your bones, you build bone. So that would include walking, running, dancing, climbing stairs. When you do these kind of exercises, you're releasing hormones that build bone. And these hormones are not site-specific. They go around your circulatory system. They affect your entire skeletal structure, so they affect every bone. So naturally we thought obesity would help with bone because you're working against gravity more than a skinny person. And it's not true. We were all wrong. When you're obese, the fat cells on your belly and all over your body, they release chemicals. They're not metabolically inactive, they're metabolically active. And the chemicals they tend to release cause inflammation. They're called cytokines. They're chemical messengers. They excite and misdirect the immune system, and you get inflamed. And part of the damage caused by this inflammation is damage to bone. So it turns out that overweight people, and I'm not talking muscle, I'm talking fat, they break down bone. They lose more bone than a typical person. So the first clue I saw, the first study I saw actually, on resveratrol building bone, it was from the Journal of Clinical Endocrinology and Metabolism. It was Our House University Hospital, their Department of Endocrinology, but also their Department of Clinical Medicine. And they did a study on 74 middle-aged guys, but these guys were overweight. I mean, these guys were obese. They had a body mass index of over 33 in general, around 34. Your body mass index is like your amount of fat and weight to your height. So a body mass index of 18.5 to 25 is normal weight. 25 to 30 is overweight. Over 30 is clinically obese. It's dangerous because when you're clinically obese, not only is it bad for your bones and your back and your knee joints, it's bad for your heart, it's bad for your brain, it's bad for your kidneys. A lot of things go wrong. So 74 middle-aged men, they were clinically obese. They had a mean age of 50. And they gave them resveratrol or placebo every day for 16 weeks. And they found important effects of the resveratrol on bone. The bone density of the lumbar spine increased. They were looking at the lumbar spine. And not only that, but they saw that the bone alkaline phosphatase also significantly increased. And it was dose dependent. The more resveratrol, the more it increased. Now, that's a very good sign. Bone alkaline phosphatase is released when you're building bone. It's involved with shoving minerals into your bone. And increasing the bone mineral density of the spine is a very good sign in overweight people. Now, a study in the journal Biomolecules gives us big reasons why resveratrol would be good for bone. It's researchers in dentistry over at the University of Palermo and other research institutions in Italy looking at resveratrol for surgical procedures in the jaw, in the gums, and the mouth because it helps assist rebuilding bone. And this is something that can help things fit better when they're doing some kind of replacement surgery in the jaw, in the mouth. So they highlighted that resveratrol promotes osteoblasts and inhibits osteoclasts. So let's discuss that. Resveratrol stimulates the production of osteoblast cells. These are cells that build bone. Meanwhile, they're restricting the activity of osteoclasts. These are cells that break down bone. When you're young, there's a balance between these bone-building cells and the bone removal cells because bone ages, so they have to remove old bone and replace it with new, healthy, strong bone. So there's a balance when you're young between building bone and removing bone. We lose that balance with age. The bone-building osteoblasts decline in number, but the osteoclasts are still very active. And resveratrol helps restore balance between them, so that's a very good finding. So here's a study from the journal Nutrition and Diabetes, and it's in diabetic patients. It's very good. It's looking at resveratrol and bone health in patients with type 2 diabetes. It's from the University of Turin over in Italy, their Department of Medical Sciences, and other academic research institutions throughout Italy. Whenever you do these big studies, it's always a combination of different academic research institutions that are interacting to get it done because there's a lot of work here. So it's basically 200 patients with type 2 diabetes. It's a double-blind, placebo-controlled, randomized human clinical trial. They were giving them resveratrol or placebo. Placebo is a fake pill every day for 6 months, and they were using different strengths of resveratrol. Now, it's important because people with type 2 diabetes, they're at an increased risk for fracture. They're finding that somehow the sugar in the blood is toxic to the bone and inflames the bone, and diabetics lose bone at a faster rate than the general population. First of all, they found that different doses of resveratrol improved bone alkaline phosphatase. Once again, that's a marker for building bone. That's something in the blood that's involved with building bone. They found that diabetics on the placebo, even within just 6 months, just a short period of time, lost a lot of bone. But the diabetics on resveratrol, they were not losing bone. It was protecting their bone mineral density, how thick their bone was, and their bone mineral content. In other words, they weren't losing calcium from their bone. That's actually a pretty significant finding, which brings me to the latest evidence on resveratrol and bone health. This is the strongest evidence yet. As from the Journal of Bone Mineral Research, it just came out. It came out June 21st this summer. It's from the University of Newcastle, the University of Southern Queensland, and the University of South Australia. And it's part of the RESHAW study. RESHAW is an acronym for the Resveratrol for Healthy Aging in Women study. So this is a big study. It's a well-powered study. It goes on for 2 years. That's a significant amount of time. There was plenty of women in the study. It works out to several hundred women in the study. And they're looking at various benefits of resveratrol. So they're breaking it down into brain health, heart health, well-being, but also bone health. So what they found was that resveratrol, they gave the women, this is a really good study. It was a big group of older women, postmenopausal women. They gave them either resveratrol or placebo, 75 milligrams of resveratrol twice a day, or placebo twice a day. It was matching in the way it looked. Placebo's a fake pill. Every day for a year, and then they were switched over, which is kind of like a higher level of evidence. So the women that first took resveratrol were now given placebo, and the women that were originally in placebo for a year were now given resveratrol. So if you duplicate the results, it's like having 2 separate studies. It's a much bigger, stronger study. And they found out no 2 ways about it that resveratrol was building bone in the lumbar spine and resveratrol was building bone in the neck of the femur. Now that's really important. The neck of the femur is where the thigh bone inserts into the hip joint. That's where people have hip fractures. Hip fractures are very dangerous. They're very painful. They're very expensive to treat. They take a long time to get past between the surgery, taking the blood thinners to prevent a blood clot related to breaking the bone, and the surgery, all the physical therapy. It's a long road to recovery. So they found that the resveratrol was building spinal tissue and hip bone tissue. That's an excellent finding. In fact, it improved their T-score. Their T-score is comparing the bone health of these older women to the bone health of much younger women. And what they found is when they did the calculations, giving resveratrol 75 milligrams twice a day over a year reduced their 10-year risk of a major fracture or suffering with a hip fracture. And when they looked at the urine, they found that the breakdown products of bone had declined in the resveratrol group. So that's all kinds of evidence there. Now, there's an additional benefit to resveratrol besides bone health. Well, we know that resveratrol is good for brain health. So that's a great additional benefit right there. But NASA is planning on giving resveratrol to astronauts. The trip to Mars, they're planning flying astronauts to Mars. With the current technology, it takes about 9 months. So it's 9 months to get to Mars, then you have to stay on Mars, and then you have to come back. Now, Mars is a much smaller planet than Earth, so there's got to be a great deal of time in space with no gravity, zero gravity, and then a period of time on Mars itself with much less gravity. So what happens without gravity, you're not fighting gravity, you lose bone and muscle. They're planning on giving the astronauts, or they're more likely planning on giving the astronauts resveratrol to help protect their muscle tissue. Very interesting stuff coming out about resveratrol. In any event, thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Please make sure you subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you on the next time on another episode of the Invite Health podcast. But before I sign off, let me just give you an email address. If you want to reach our nutritionists, if you have any questions on any of these podcasts, this goes to 5 of our nutritionists. Nutrition@invitehealth.com. Nutrition@invitehealth.com. That's an email address. Thank you so much for listening.